Was an event reporting form. Everyone that's doing the Walgreens, and everybody that even did it last week, this is a form that has to be turned in on a weekly basis. John's gonna get an Excel format out, also on a weekly basis, probably with the Project 15. But for this week, you can just fill one of these out. And if you like to not do the Excel spreadsheet, fill this out however you want to, as long as you get it turned in each Friday. We're actually a day late from reporting this week, but you know, we're trying to get caught up on what needs to be done with this. So, very, very simply on the event reporting, that needs to be turned in Friday. I know if you have an event on Friday, you can also just add that either on Saturday morning or Monday, that's fine, either way. The reporting needs to be done by Monday at some point. So, very simply, if you look at it, all that it's doing is it asks for very simple information for your agent ID, your name. So you can see on top there, it asks for which store you're at. So the store name, Goose Creek, city and state, or Remount Road, city and state, very simply. All that we're asking is your start date and your end date, which means what day did you do it. If you're there on Monday, Wednesday, and Friday, then put those dates. Put start date and end date for 3 different times. So each week you want to put start date and date for 3 different times, whatever days you're there. It asks for your hours worked, which should be 5 hours for each time. If you're there a little longer, you can put that, but it has to be the minimum of 5 hours that you're there. And again, the times that you're scheduled. How many people visited you? Again, approximate. Hopefully you're kind of keeping notes. Again, before we didn't know exactly how many, so for last week, please approximate what you did. From now on, kind of keep track of how many people are coming to see you. I don't care if it's my little check marks, my M&Ms, whatever it is. Qualified leads.
Can't have candy.
Can't have candy, sorry about that. Thanks, Lynn. Qualified leads, which essentially how many people did you actually get filled out a lead, or a skip of appointment, or an actual appointment time to get back and see. And then of course if you did any sales at that time too. Because you can do some sales through there too. So these need to be filled out on a weekly basis. And we need to update those to keep them in the system. So that's the easiest part of today.
This front paychecks?
It's just like Project 15. You don't get it turned in, and hopefully everybody will be able to do it. We don't have to pull anything and say you don't get any leads or anything like that. Hopefully we don't have to do that. It's a pretty simple thing. It should take you 5 minutes to do. So, please, the ones that saw them last week, please get these turned in today so we can get them updated. Because we're not even really sure how to update the system yet. I'm learning that on a day-by-day basis here. I did get word that supplies are for care improvement are supposed to be here on Thursday. I hesitate to say that, I should tell you Friday, but they're supposed to be here on Thursday. Again, they say keep your fingers crossed, but they've actually been shipped out. Our bulk shipment's supposed to be here. So hopefully by Friday, when you guys all come in, we'll have supplies here. I wouldn't plan on coming to get them Thursday because they're going to come in boxes and they're not going to be pulled out and separated stuff. So I would plan on coming in Friday to get them. We're also going to be changing the schedule for the MAs a little bit. We want you to get as many appointments you can get out there. Of course, get as many sales. Everybody knows the 48-hour rule of getting the MAs turned in. On Friday, you've got to get them turned in the same day. Hopefully you get them all turned into John because they have different guidelines. John's going to send you out the guidelines in case you have a weekend one that you have to get faxed in, but the scope of appointment has to be faxed to a different place than the application does. So it's a little bit more confusing this year. So, again, hopefully you just get them all turned into John. Let him worry about sending them to different places, because I don't want you to have one part not show the other part and holding it up and pending and not knowing about that for a while.
So Friday has to be turned in same day?
When else are you going to turn it in?
Monday.
Yeah, for 48 hours. They don't go by business days.
Not business days, huh?
No. So
So
you do it on Friday, you need to turn it in, or you're going to need to fax it yourself on Saturday,
Correct.
which means then you got to follow those rules. So again, I'd try to find a way to get it in if I could. But John's going to get those rules out to everybody in email. So it's not that bad, but again, just make it easier. Scope of appointment. I did just make some copies of those too. Can you grab this one? No, this one. Copy. Thank you. I'm just going to hand out one scope of appointment form. Hopefully everybody makes a bunch of copies for themselves. We are able to use the one that came out in June. So the one with the hospital indemnity and everything, we're allowed to use that for any of the carriers. It is CMS approved.
Yay.
So, I found out they said, yeah, they will be able to use that, so unless somebody comes back and says that's bad, then we go ahead and use that. But this one is the one that is a little bit easier, is a little bit more liberal, allows you to do, you know, the hospital indemnity with your Medicare Advantage. And we're gonna talk a little bit about that today too. Yeah, the second page is you're getting yourself, this is the only part that has to be signed. The second page is what you actually leave with the member. The scope was actually on one page.
We put that in the life insurance application.
Alright, MA schedule is gonna change a little bit, that's what I was talking to you about, and I kinda threw myself off track. MA schedule is gonna be, we're still gonna be coming in on Tuesdays and Fridays, that's when leads are gonna be handed out. The leads, as you all know, almost everyone's into the lead system. We're gonna be getting, we had a bid drop that we did ourselves, company-wide here in South Carolina, over 35,000. Cutler also dropped over 80,000 names. Of course, some other people also got into the, we were able to drop another 10,000 total through Universal Healthcare. And we also have a couple of lead sources through Cutler and through United Healthcare. So we've got a lot of different leads that will be coming in. We're going to be giving out leads starting at 8:30 in the morning on Tuesdays and Fridays. So everybody needs to come in Tuesdays and Fridays, and also we're going to get announcements out. Hopefully we'll be able to come in, get leads, book, and get back out in the field in the afternoon. So we're planning on everybody being here between 8:30 and 12 on Tuesdays and Fridays, and then back out in the field to schedule the rest of your appointments in the afternoon. So also reporting needs to be done on a nightly basis. I know most of you are really good, at least on my team, probably other teams also, about reporting to the managers. Needs to be done on a nightly basis. However your manager likes it. My team would like either texting or email with the numbers and how many MAs and how many sales, commissions, NAP, same things that you always do. But those need to be done on a nightly basis so we can stay on top of it, of how many are going to be turned in, so John doesn't get flooded with all of a sudden one day a couple hundred coming in. So those need to be done on a nightly basis. While we're in here, especially during this MA season, I'm going to try to help everybody as much as possible, but we've got a lot of people now, and there's a lot of stuff coming to me with questions. We have set up a Google Doc fact sheet that you guys will be getting emailed at any time. You can go in there and check the fact sheet. If you have a question, you can post right on there, and either myself, John, anybody can get in there and quickly answer it. So it is posted there, so you may have the same question somebody else has. Since we're going to be out in the field a lot, we're not going to be in the office a lot. Somebody else may ask that same question about a Walgreens store or reporting or something else. It'll be right there on the Google Docs. If it's not there, ask the question on there. It'll notify me and the other managers that also when a question goes on there. So hopefully we can answer it right away. I will have my iPad out in the field at all times, so I will try to answer this as quickly as possible. But I think it's going to be much more efficient to get the information out to people and to get answers back pretty quickly. And you should be able to check this with your cell phones too. Do you think the Google Docs? Yeah, I think you can.
You can.
Okay, good. I'm not great with it yet. Just another thing to know.
Yeah, it's not hard.
It's really easy to check. So, we're also going to be doing a little bit of a telemarketing campaign, hopefully coming up for AARP MedSup for people that are turning 65. And coincidentally, with all its MA, we cannot telemarket on MAs. So we're going to reach out to a lot of our folks that are turning 65 for AARP MedSups. We do have a bunch of MedSups in here. Right now, I talked to United Healthcare. They're going to use a 2012 MedSup for 2013 right now until they get further notice updates. They don't plan on updating it until the spring. So right now, you can continue to use your 2012 even if somebody's birthday is in January right now, because I know we're into January birthdays for MedSups. One thing which came to my attention I didn't realize, if somebody wants an AARP MedSup, they do have to be enrolled in AARP. I know it sounds dumb, but you cannot, if they're not enrolled in AARP, they have to enroll right then when they're on the MedSup, or they cannot be eligible for the MedSup.
What about for the MAs?
They can't.
The MAs, yes. The MA is not AARP. It's actually the HMO through Secure Horizons. But the actual MedSup is AARP. Yeah, so, that's how they're able to get the group discounts on that, and so I was not aware of it either, so, just wanted to kind of pass that along. Okay, that's kind of, hang on. Don, do you have any other announcements before I kind of, okay. Alright, gonna pass out, just take one, pass it around. Just crack a bottle of beer in the wall.
I know, I'm scared you can smell it when it is.
Okay, what we're gonna quickly go over, I don't wanna take up all of, a lot much of your time. I really wanna be able to get all this information out to you. I spent quite a bit of time putting this together, that hopefully what I'm giving you here, you put into your books. These first things that I'm giving to you are maps for all of our carriers that we currently work with and use. These maps, hopefully you'll put it right in the front of your books, show you the counties for the different plans. The very first one, they're showing you America's First Choice, PPO and PFFS. It'll show you exactly which counties that they're in and they're available. So if you're in somebody's house and you don't have access to be able to get onto the internet, or somebody's wondering about the plan being in that county, it should be able to tell you. I also have the Humana maps, which shows their HMO along with the LPPO plan. I didn't put the RPPO because it's in the entire state of South Carolina and Georgia, so I figured you guys would figure that one out. Maybe I should have put it, no, I'm just kidding. And then the very last one was the Universal Healthcare, the NENE plan. I know right now, their premium had gone up quite a bit, and so I don't know how many of these that we'll be actually offering to people. I'm also working on still trying to see if they can get somebody over for a quick training to be able to offer it if we do run into it. So I'm working on that right now. But this is also a breakdown of the counties in Georgia and South Carolina, and North Carolina is on there too, by the way. So you can see just a breakdown of their quick benefits, and mainly the counties. So hopefully just put these kind of in the front of your MA book as you're getting it together and going over it with people. And that'll give you a quick reference sheet of which products are available in which counties. I didn't put Care Improvement because, as you know, it's available in every county. All of their programs are available in every county. They do have a couple of LPPO counties, and you should have those LPPO books with you. We're not going to be writing that, but maybe 5 to 10% of the time. There's only going to be one product that you're going to want to write the LPPO product for Care Improvement. The RPPO will be almost all the time. The LPPO, the only time that you'll be writing it is for the MAPD plan in the LPPO counties. Now that means just the regular MAPD, not any of the disease ones, the gold, the silver, none of the duals, the Medicaid, the chrome, or the copper, none of those. Just the regular old MAPD plan in the LPPO county. That's the only time that you'll write that product. That's the only time that's going to be better for people. Every other time it's going to be the RPPO. So 90% of the plans that you're writing for Care Improvement are going to be in this plan. This is the only book we have coming in right this second. I have an order for these, but they're going to be in probably sometime next week. So I wouldn't worry too much about it. If you happen to run into it, we can print off an application for it. But I think most people are going to be focusing on their clients that are in the RPPO counties right now. And mostly, hopefully the first couple of weeks, the duals, the silvers, and the gold plans, and you're focusing on those, yeah.
In those counties, you can still write the RPPO, correct?
Yeah.
Except there's a difference in benefits
There's
where?
a slightly difference in benefits, which you'll see here. I have the grids here to pass out. But this is the only time that's going to be better, even slightly better for your clients. Every other time it's going to be the RPPO. So it makes it a little bit easier this year. You can pretty much know that almost every time you write the RPPO.
The LPPO is for people who don't have any problems with them now.
That's correct. You can put it that way, yeah. That don't have any of those special conditions or
Right.
special programs. That's correct. First thing I'm going to hand out
Not sick.
is I did benefit grids. I did 3 different benefit grids. Kind of similar to what we did with the final expense. The first one is for all the United Healthcare products. Now it's very, very important that you realize that these benefit grids, on the very top here it says Cornerstone agent use only, not intended for public. You're not allowed to distribute these to clients. We're not even allowed to really show these to clients. These are for you as your reference. These are internal reports we created. These aren't stuff that was created by the company, so that's very, very important. We wanna make sure that we stay, CMS compliant. So I put that on there. These are just for you. So put these in your book, hopefully in the little sleeve in there, and this for your reference.
Thank you.
It's my full disclaimer. As you can see, I started with the CIP, the gold, silver, dual products. All the disease products that are there. Pretty much what it shows on there is, number one, the premium across the board. That's pretty simple. They're all zero premium. That should make it pretty easy for you. I also showed the maximum out of pockets across the board. They do vary by plan, which was kind of interesting. Inpatient hospital stays. I didn't go ahead on the silver and the dual. I didn't put 20% like they do on anything because they're paid by Medicaid. And these are internal reports for us to use. So you can see that you know it's inpatient hospital stay, that 20% is picked up by Medicaid anyway. So I showed the actual real numbers so you can sit there and talk to a client and intelligently know about that. I showed the inpatient hospital stays. As you can all see, that they all came down the amount of days. Some of the plans are 5 days, some are up to 9 days. But last year they had them up to 15 days on the inpatient hospital stay. So they came down quite a bit, so that's awesome. Also, they're all, except for the MAPD, the RPPO and the LPPO, they're all 195 per day in the hospital. The LPPO and the RPPO went to 295 a day. And then of course the HMO is over there on the side, the last one. Now the HMO locally is really going to be only in this Charleston County. I don't think a lot of people are going to be working the HMO too much, but I want it there so you can see it and you can compare it to everything else. Going down the board, I don't want to go over every single one. You guys know what PCP and specialist is. Obviously the doctors and the specialists, the difference between there. The skilled nursing is very important, especially if we're doing the hospital indemnity, to hopefully partner up with it so you know exactly what you're covering. Outpatient surgery, emergency care, urgent care. The urgent care has all kind of went up this year across the board, I noticed on all the plans. They're all up there in that $25, $30 range. Ambulance, again, routine podiatry. So you can kind of see how that's covered. Your prescription drugs. Prescriptions are always going to be very important, and to see how they're covered all the way through there. Transportation, some of the other, the dental, the vision, the dentures, which plans have dentures. Hearing, every single plan does have hearing benefits. That's kind of big this year, that's a new one. And then the over-the-counter benefits are only on 2 of the plans for next year. So I think these are all the benefits that are kind of important to people when you're out meeting with somebody. And hopefully in a very quick few minutes you can see which plan has which benefits. And it should make it pretty easy to talk about.
There's no cap to that hearing aid, they just pay, someone pays $340, $390, and then they get 2 hearing aids?
That's a copay per hearing aid.
Still, so they pay $700 for like
Yeah.
$4,000 with the hearing aids.
That's correct.
Is that how much one costs, is $4,000?
Yeah, I just had a client who had a bill in front of her, and it was $3,800 for the hearing aid, so.
Skilled nursing facilities got a $50 copay per day in the LPPO and the RPPO?
Yeah, most of them, like Humana's got a $50 per day too. A lot of people don't realize that. I'm getting ready to pull out the other benefits, and you'll see the other companies. They almost all have a co-payment on there. That's the one downside to not being on Medicare. We have a Medicare Advantage, is having that co-payment on there. So you just need to let people know so they understand that. But you can cover the days 21 through 100 with the hospital indemnity. And that's where it goes up to 100, 150, depending on which plan that you're on. Oh, no, okay. Alright, I'm going to pass around. I'm not going to spend a whole bunch of time reading everything to you. If you guys have questions, please stop me. Because I do just want to kind of quickly go over everything. I know that people got things to do, but I want to make sure we cover everything as best as possible. And if not, you can put it on the Google Docs page. This one here is covering the rest of our MAPD products. This is covering the Humana, America's First Choice, and the Any plans. And I put all of them on there, the Humana HMO, the LPPO and RPPO, the Humana medical only, because we do use that for people that are on VA coverage or have a separate plan that they go somewhere else with their prescriptions. The America's First Choice PPO and PFFS, and their medical only, and then the any PPO and PFFS. So there's a lot of plans on there. It should make it pretty easy in the house to compare. The only plans I didn't put on there are a couple of the plans that are available out there. There aren't many though. I mean, we pretty much have most of them covered.
These are awesome. These are so awesome.
Yeah, thanks, Scott.
I know, it's
Yeah,
gonna make it a lot
that's-
easier.
Yeah, no problem.
Thank you.
And a nice
Um,
easy way to break it down.
Is that that one that you said?
Well, the big thing is that there are some things that stood out to me. The inpatient hospital across the board is a lot more expensive than the United Healthcare. You start looking at Humana, $250. The medical only went up to $900 flat even. The America's First Choice, $295, $315. So per day, they got some pretty big, and any plans went to $395 and $322. So across the board, the United Healthcare's and the care improvements are actually a lot cheaper in the hospital part.
That's a per occurrence, right?
But
So that can happen more than once a year,
Yes.
that's 5 days.
yes,
It's more than actual Medicare.
yeah.
PCP and specialists for the.
So it's kind of big. Look at that. Also look at the PCP and specialists, except for the America's First Choice medical only. Everything else is most of the Humanas are. You know, some of the LPPO, the RPPO is $20 for a visit, 20 and 45. So they all kind of come back together a little bit. There's not a huge difference between them. What else stood out to me? And again, when you get to all the dental, transportation, vision, things like that, there's not a lot of plans that have much out there. Again, America's First Choice, but as you guys know, America's First Choice for 2013 is non-commissionable. So you can still write it,
Which one?
but it's for your well-being and for your clients.
When does this start back up?
They haven't said yet. They'll wait and see how the annual enrollment starts and goes. Again, over-the-counter benefits, hearing,
I don't understand that.
but
Are they just planning on doing it all online and telemarketing? They don't expect real people?
no, they don't want an influx. They want to see what's gonna happen with all the changes and all the companies that have been kind of merged together, like United Healthcare, Care Improvement, Humana and Southeast Community Care, those type of things. They're waiting to see what shakes out. And then worry about next year, probably, I would guess, probably after the annual disenrollment, probably sometime in March, is what I'm guessing is gonna happen. No, they're only regional in 3 states. So think about that, it's just North Carolina, South Carolina, Georgia.
Humana HMO is good.
Humana HMO is not bad until you start looking at, they don't have anything, when it comes to any of the extra benefits, they got nothing at all there. If you start looking at that, it's also the same hospital, actually a little more than like the Care Improvement. You're saving $10 of going to the doctor.
A lot of the care improvement we're gonna do is the RPPO though, right? I mean, we're gonna do the gold and silver we'd have done already. Like open enrollment, I would figure is gonna be the RPPO, right?
And a lot of the dual, RPPO, the chrome, the copper, yeah.
And it's the people that like in Ori and Georgetown that we couldn't put.
But the Humana HMO, actually, once you break it down, you kind of look at everything. And the very beginning, if you look at the PCP, it looks better, but the hospital's actually more. The specialist right there, it doesn't have any extras. The drugs, you don't get any breaks on at all. And then knowing that it's an HMO, and you know, everybody knows how an HMO works, correct? Everybody knows the difference between the HMO?
On the mail order, it is.
I got to get ready to go out.
They don't have anything wrong with it, it's either this.
Everybody talks among themselves. Okay. Alright, that's done. HMO is a health maintenance organization. What that is, it is essentially managed care.
Kaiser.
That's what HMOs, the reason why HMOs are created is because they can get doctors under contract, they can know exactly what amount of money they're putting out, and they can manage their care. And so what an HMO does is they build a network. A network of doctors. When you join an HMO, your doctor has to be inside that network. If your primary care doctor is not inside that network, you have to find a primary care doctor that is inside that network. So your doctor has to be inside that network. Your doctor managed everything. Your doctor is kind of like the quarterback. Where if you need to go see a specialist, he refers you out, and that's how you get your managed care. Now, most of the time on an HMO, if you go see a doctor or a hospital that's outside your network, you're responsible for those costs.
Unless it's an
So
emergency.
unless it's an emergency, but yeah, even a lot of times you'll come out a lot more out of pocket than you would normally. So an HMO, it is truly managed care. So when you're talking about the Humana HMO, you are talking about a little bit more restricted. Now Humana is a pretty big company, so you know it's a pretty good network of doctors, but it is a little bit more restrictive. A PPO also does have a network. The biggest key about that is you don't have, your primary care doctor doesn't have to be inside that network. It can be inside or out. You can see your primary care doctor. Now, if you stay inside the network here, then you're going to be getting the lower co-payments on a normal basis on a PPO. If you go outside of there, you have freedom to go outside of the network, but you're usually going to pay a higher co-share or co-payment. But it's not something that you're going to be paying 100%. So again, you know that you have doctors that are under contract, that you can go see those doctors, so you have that comfort of knowing that you can be seen. But you can also go see a doctor that's not under the contract as long as they're willing to take that plan at that time. And then the private fee-for-service, they are networked now, but it is much more loosely networked, to where you can go to any doctor that agrees to the terms and conditions of the plan that you're presenting to them. So you can go to any doctor that accepts Medicare and that plan that you're in. So right now, being America's First Choice is a private fee-for-service, and the Indiana plan had a private fee-for-service. Care Improvement Plus, theirs is kind of a mix. Theirs is a PPO, but it's a POS, which is point of service, which means all the doctors have to do is agree to get paid by Care Improvement. So again, it's one of the most loosely open plans. So it is a little bit of a difference, Jim, from the HMO. You know, it's not a bad plan, I agree, but it is a little bit different. And they don't have any of the extras in there. And I was a little disappointed, they don't even have the silver sneakers in that either, in the HMO. Yeah, I was a little disappointed in that. They do in the PPO, but not in the HMO.
Scott, on our clients that have had Southeast, and then they got the letter stating that it's going to be replaced, well, I'm not quite sure if they're just offering them the HMO.
They're giving them a choice of plans they want to go into, but they're merging them into what they call the Arcadia, which is the HMO that's on here.
So if they don't choose anything different, they're automatically going into
That's correct.
Humana. Okay, so that means if I go and I'm meeting with my client, and I'm sitting down and I'm doing a comparison between the Humana and the Care Improvement Plus, if they decide to go with the Humana, I don't enroll them in it, I don't get any commission
That's
for
correct.
that sale. If they just automatically stick with that program.
Now, if you enroll them in the Humana PPO, I'm guessing you would get a commission because it's not something they're already enrolled in. As of right now, they're enrolled in Southeast Community Care.
Okay.
Until January 1st, they're enrolled in Southeast Community Care.
So if they were with Southeast, unless I change them into Care Improvement, I don't get any sales commission on that, even if I say, to them, the other plan probably works better.
Yeah, well, the HMO, in order to offer the HMO for Humana, you do have to go do that specialty HMO training. So if anybody does want to offer it, I honestly don't see a huge benefit of it. That's just me going through all the plans personally. I don't know how often that you are going to do that. If so, they do have a training that it is next Wednesday. I think it's next Wednesday. But I really don't think it's going to be a big thing to do. So unless you want to spend 4 more hours into the MA training for a product that you may not offer. I know Norman does.
I know.
Alright.
They got generics mailed to them for free, that saved them $50, as opposed to the Care Improvement, that would have been spending $80 per generic medication, so they stuck with the Humana.
Yeah, no, Humana's a good plan. I have many clients on the Humana plan too. Humana's a good plan. They are really good with the Right Source RX on mailing out the prescription drugs. Now, you know, you do have Medco as your prescription drug provider through Care Improvement United Healthcare, which is also very good. And I would suggest looking at the formularies. I ran into one yesterday that on the Humana formulary, a couple of drugs were brand name drugs, where on the Care Improvements they were generic. And so it is good to look at the formularies and to compare and see. And that's part of the thing that we really should be doing with somebody that's taking some expensive drugs, to making sure you put them in the right plan, because drugs are something that normally aren't changing. That's normally a constant from month to month. In that case yesterday, they were paying $45 for each of those drugs, and they could actually go on and get mail order for $20 through Care Improvement for 90-day supply. So,
They don't have any of theirs for zero though, do
no,
they?
no.
I mean, that's ours, and I got a guy who's got 5 mail order ones that he's getting for free.
I'll take that next up.
So again, it's just looking at the plans thoroughly and making sure you're doing the right things for the clients. This last one is prescription drug plans. We do have a little bit more on prescription drug plans this year besides just the Humana. We do have the AARP, United Healthcare prescription drug plans. And as you can see, the very first one, they added a brand new one this year. So they've got their Humana Walmart version of their Saver Plus PDP. Now it's really pretty cool to look at these. Yeah, that's a very, very low premium of $15. They do have a deductible on them. So look at this lower, the Walmart plan and also the AARP plan. I think Jane has it together.
Give me the last page.
You do have deductibles on those too. The rest of them do not have a deductible, so that's very important.
We all need one too, Mark.
Did y'all pass out
The drug plans, they should be coming around.
Yeah. They were passed out here.
Who needs drugs?
Who needs-
Needed in drug, one
Is there anyone from what, 15 items?
Oh, wait, say one more.
And you make, 15.
What is it? Who hit the gap? Because it's still, through the gap, is it all of a sudden number for that? That's the people who hit the gap.
Southeast United here,
They're still not working.
card yesterday, and she just got a new one in from them.
Unless they're hitting the gap, that's what people just hitting the gap.
$10.
Because they're not
That
paying
could change to
attention
the,
gap.
Humana HMO, yeah.
it's gonna convert over. I wasn't sure what to tell her on that. Okay.
All right, do we have any questions? If we have questions, let's get it out so somebody can hear.
We talked about having to get specially certified for the Humana HMO. For the United Healthcare Secure Horizons, do we have to do additional training for that, or we're
No.
okay to sell that?
Yeah, we're already good for that. We did training for that as part of your portal, if you remember doing the HMO training. Now, Humana, because this is the first time they're offering it to brokers, so that's why they're reaching out for the additional training. They didn't offer it last year, the brokers. Okay.
Are you gonna discuss commission on the prescription plans?
I wasn't ready to. I mean, I kind of know, where it is a little bit higher than what we had seen previously. I don't, it's on the commission statements.
Okay.
I've never seen this.
It's on,
You have to be there to get
I've never paid that one for a drug plan, I'm sorry.
no. Because the client I ran into got the drug plan, but it doesn't have the supplement, so. Alright,
Nice to know the med substitute.
yeah. Okay, so you do have 3 drug plans on each. It's kind of interesting to look at the differences between them. As you can see, their Saver Plus, that they're trying to do similar to what the Walmart drug plan was doing, where $1 on your preferred generics, $2 on your tier 2 generics at their preferred networks. The other networks, you're probably not really going to run into it. I think most of the people, if they're going to the larger pharmacies, are on the preferred networks. If you look in their plans, there's a lot of them in there. So their tier 3 is $25. They're brand names, which is pretty good. I mean, that's $20 less than a lot of the other plans out there. and then the tier 4s are 45. That's really, really strong.
That's great.
Yeah, so that's really good. Again, their preferred PDP plan is really good too. It's strong. You don't have a deductible for that. That's where a lot of people have been in the past. And again, your biggest important thing of these is just to look at the formularies, is to make sure that the formularies are the right things for the people, because somebody can be in a tier 2 generic formulary on the preferred, but on the Saver Plus it may be a brand name. So
Get their formulary online.
yeah, you can get the formularies online. You'll be getting it in your welcome kit that should be coming out to you. Everybody's getting a welcome kit. You have a formulary in there.
They said it's not showing up on the Medicare website or something, and they hope to get it fixed by the 15th.
You can go online. You can go on United Healthcare and get
Yeah, I'm just saying, it's like, when you do the comparisons on the Medicare website.
There could be different
the
formularies
PDPs
per
aren't
plan.
there yet.
it. Oh yeah. There's always different formularies per plan.
I'm saying within the same company?
Yeah, always is. Humana did vary last year according to plan too. Because their cheaper plans is really geared towards generic type drugs and not geared towards the brand drugs. So the brand drugs are a lot more expensive on there. A lot of times they tier them up versus those generic drugs. So it's very important before you put somebody into the cheapest $15, hey, I got your drug plan for 15 bucks. Yeah, that's all well and good, but all of a sudden one of the drugs is $100 a month. You didn't do them a very good service of that. So it's really important to check formularies. One of the big things to look on the Humana one, obviously you saw on there that put mail order with right source on any of their plans. They also, on their plans, have $0 preferred and non-preferred generics. The non-preferred generics is new this year. Last year they only did it on the preferred generics, which is really pretty cool. So pretty much all the generic drugs they have listed in their formularies, you'll be able to get through the right source for no copayment at all. They also have dental, hearing, and vision discounts that come with their drug plans, which is pretty cool. And then the Humana Complete, the $115 plan. It's kind of interesting because all of their generics and a lot of their brand drugs are covered through the gap. So those are your people that just have all kinds of high-priced medications. I know it's a lot to pay $115, but if they have some of their,
Prescriptions cost them $75 each time.
oh, that would cost them $400 or $300, you know, through the dental hole, that may be a good plan for them to be able to check to have it's covered through there. That would be a good phone call to the company, because I don't know exactly how to tell which brands. They say some brands are covered through the gap.
What about with our discount card? Does that play in this at all? People that are paying that kind of money?
Well, that's always a good thing to have with a discount card, is the people that are hitting the donut hole, it is going to give them discounts through the donut hole. It's going to help them out, yes. But there's some pretty good drug plans out there, and I really like this the Saver Plus and the ARP. Again, I haven't gone through the whole formularies, but I think it's got some pretty strong drug plans in there, especially to partner up with the AARP MedSup.
Especially after Humana's huge increase, looks like they're.
Well, for those of you who saw Forethought just had their increase recently, and especially like on their Plan Gs, they only increased 5%. I think that was a great increase. I think that should keep a lot of your clients pretty happy. You only have a 5% increase when a lot of our companies are going double-digit increases this year. So the Plan Gs are the ones that are getting the smaller increases. It never was the cheapest F.
Well, I mean, that we have. Central State.
Yeah, I mean, AARP's got a good one too. If you're 65 to 70, people that are turning 65 to 70, the Plan F's the best out there, because they give you discounts when you're first turning 65 all the way up to age 70. You get discounts.
You gotta be a member of AARP.
You do have to be a member of AARP, and it's in the packet. I think you'll somewhere.
$16 a year.